Hey guys, Dr. Gonzalez here. Today I wanted to do another video on coronavirus as I haven't done one in a while. And I wanted to concentrate and talk primarily about the different tests that we actually have at the moment when it comes to this COVID-19. Because there's two types of different tests, and it's important to understand when should you do one versus the other. Because one test is what we call the PCR test, or that's the test that actually checks to see if an individual has the actual disease. And then there's the other test, what we refer to as the antibody test, or that serologic test that we're hearing a lot on the news. Now that test is very important because it shows if someone had already contracted the disease and in turn has some type of immunity to the test. Now, I wanted to explain it in the simplest way possible, so I'm going to use my whiteboard for educational and explanation purpose. I wanted to talk about the first type of test, which is the one that we've been doing, and we have tested over 4 million Americans up to now, up to the day of this recording video. And that's the test that actually checks for the virus. Now, saying that we have the virus here on the right side of my whiteboard, every virus or any pathogen, including coronavirus, it has a unique gene sequence, either by DNA or RNA. In this case, coronavirus is an RNA virus, but it has a unique sequence. And that unique sequence is actually what machines can identify. So, because we don't know what that gene sequence looks like, we could put it into a machine, and that machine will look for that individual unique sequence, and it's going to either tell us that that gene sequence is found, or that virus is there, or it's not. Example, if I don't have the disease, actually I don't have the disease, but if I were to do that test right now, that the machine or that test is going to look for that gene sequence of the virus, and because it's not going to find it, it's going to give me a negative test. But what happens if tomorrow I come in contact with someone that has coronavirus and I contract the disease? Now I'm going to have the virus in my respiratory tract, and we send the same test again. That machine is going to look for that genetic code, and that test is going to come back as positive. Now, saying that we recover from the virus, I recover from the virus, takes me a couple of days, a week, but my body is able to fight away the infection. The virus is killed and is no longer in my body. I repeat the test. The body or the machine, the test, is going to look for that genetic sequence and is no longer going to find it because it's already been destroyed, and the test again is going to be negative. Now, it's important to understand that if I test for the coronavirus today and I'm not exposed, that doesn't mean that tomorrow I cannot contract the disease, because I could. In contrast, the other test, which we're talking about serologic testing, or we talk about that antibody test, we are able to see if someone has already developed a immunological response, or someone had already developed that, or had gotten sick with the disease and had developed immunity. In order to understand exactly how that test works, I wanted to do a quick little demonstration or explain how your body's immune system works. So on my right side of the screen, we have our antibodies, which are drawn here. Excuse my drawing, but our little fighter here is the immunological system, or our immune system, okay? This is what defends our body from foreign invaders. In this case, a foreign invader, or an offense, a pathogen, is the coronavirus. Now, when our antibodies, which we refer to as antibodies, AB, when the antibody senses that there is an infection or an aggression into the body, the antibody system or your immune system, it starts to analyze how can I defeat the virus. And when doing so, it begins to create different equipment to fight off the infection. This is for simplicity. And as the body fights the infection, it develops new tools, and I'm going to draw here a little tool, which in this case is a SOAR. Again, for educational purpose, this is the SOAR that your immune system was able to develop, and with this SOAR, he's able to kill the virus. Now, whenever the virus gets killed, your body develops these immunoglobulins, which are the antibodies, and when which we call immunoglobulin G. You could remember as immunoglobulin G as immunoglobulin good as in G, or G as in good. And this immune globulin, or this antibody, stays in your body for a longer period of time. So once we are able to fight, once the antibody fights the disease, kills the disease, you get cure from the disease, this antibody stays in your body. This immunoglobulin G does not go away. And we actually have tests that can check for the presence of immunoglobulin G, which is the antibody that had developed the necessary tools to fight the infection. And that's why we say that once you get the infection, you are technically immune. Because if you were to get exposed again by another patient that had coronavirus and this infects your body, your own immune system will know exactly what it needs to do to fight and kill the virus, because you have already developed the tools or the necessary weaponry to destroy the virus. So if you want to test, you want to see if someone had developed the infection and or has immunity to the infection, you want to check for the antibody test. What you're looking for is antigen G, or immunoglobulin G. If someone has the disease and they're symptomatic, they're sick, they're cough, you want to check for the actual virus. Hope that answers some of the questions, and you guys could understand the two different types of testings for coronavirus.